EMDR has a standard protocol, but that protocol is tailored to the individual person's needs, to their what they're wanting to work on, as well as kind of the complexity of their history. So everybody goes through the assessment phase where we're determining whether or not EMDR is an appropriate treatment for the person. And then there's some treatment planning. We have to identify the specific targets. We call them targets. That just means the events that we want to process.
Part of the process as we get started is helping you to build up some coping, to make sure that you're prepared for this treatment. Make sure that you're prepared to deal with your trauma. Everybody avoids their trauma because it hurts, and so facing it is going to be difficult. So part of it is preparing for it. The other part of it is in session, being able to spend the end of the session bringing you down, wrapping things up so that you don't leave raw and exposed and feeling unable to tolerate it.
You'll have to give me a picture that represents the worst part of what happened. And I'm going to ask you details about that. I will ask you about, when you picture this, what do you think? What do you feel? What do you hear? What do you smell? On the one hand, I'll ask you to think about this picture that you've developed and talked a little bit to me about. I'll ask you to hold that with the negative belief that you have about yourself when you think about the situation, along with the feelings and the body sensations. And you hold that and you keep that stuff in your head while at the same time attending to an external stimulus. And so the stimulus could be a lot of different things. Some therapists use pulsars, where there's a tone that occurs in each of your hand back and forth. Some use auditory tones, some use eye movements. You and I will talk about which one you're most comfortable with, and we'll come up with whichever one we decide we want to use. And so literally the instructions are, let whatever happens. So you're going to be paying attention to what's going on in your head, and you're going to be paying attention to the stimulus that's going to kind of go back and forth, and you're just going to see what happens. We'll go for a set, which may last 20 seconds or several minutes, and then at the end of that set, I'll stop us. I'll ask you just to simply report what occurred. So that may be new memories, new insights, body sensations, feelings, any or all of that. And all you have to do is tell me what happened. And then I'm going to direct you as to what to focus on in the next set. So the next set occurs, and you'll focus on what's going on inside of your head as well as the stimulus that we're using. And we'll just keep processing you out like that until the end of the session, and or until that particular incident or image no longer makes you upset or distresses you.
Once things start to shift, once the emotions start to de-intensify, once the negative beliefs start to shift out of where they are, then we're going to start focusing on the positive belief that you want to hold with this. And then we're going to shorten the bilateral stimulation, but still have you hold an image of the trauma with the belief you want to hold about yourself until it feels real. EMDR doesn't change your story. Your trauma story is what it is, and you can't undo what's been done. But what EMDR can do is change the way you experience it, the way you make sense of it, so that you can live your life more completely without it weighing you down.